Are Kegel exercises safe? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. The question is, are Kegel exercises safe? The answer is yeah, sure they are. You can't go wrong doing them, especially if you don't use any devices like emsella chair, which is something I have and I do recommend to my patients that are doing the Kegel exercises for you. You see, emsella chair is great. It does 400 Kegels a minute, which is unbelievable, but that's not for every type of pelvic floor dysfunction. But in general, the kind of Kegel exercises that you do at home, you can't go wrong. But the non-relaxing pelvic floor dysfunction, the Kegel exercises are not the right answer. So we're going to put that aside. For all the other ones, yes, Kegel exercises are correct. The question is, are you doing them correctly? And that's the key. So the instruction is you go to the bathroom, you kind of pinch the urination, and that kind of gives you an understanding of what Kegel is supposed to feel like. But in reality, when we are looking at the integrity of Kegel exercises, we're looking at how much you can hold those muscles, how strong is that hold, how many times you can repeatedly contract and let go. And frankly, when it comes to Kegel exercises, instead of pinching or compressing, you need to think about pinching, compressing, and pulling inward. That's really the right feel of what Kegel is all about. Are they safe? Yes. Are they important? Yes. But are they the top of the important muscles to do? No. The first thing that needs to be done when it comes to pelvic floor dysfunction, weakness or not, is to assess the housing of the pelvic floor. You don't start paying attention to what kind of tiles you want to put in a room where the whole house, you don't know if it's stable enough to even hold the floor. So I think when it comes to pelvic floor dysfunction, a lot of times we've gotten it backwards. Does it matter? Absolutely. Are we doing things not necessarily in the order of importance? It seems that way. So it seems like everyone is dealing with putting the tile down, but no one's paying attention to the housing that this is the floor of. So I'm talking about the importance of the integrity of the bones and the joints in the pelvis, which are sacroiliac joint in the back and the pubic area, pubic symphysis in the front, your hip joints attached to it, the lower back connected to it, the connective tissue that keeps all of these joints together. So does that mean that all of those need to be addressed? Absolutely yes. Does it mean it gets addressed? No, hardly. So if you really want to get to the bottom of your pelvic floor dysfunction from that perspective, make sure you use one of the methods of contact in the description box to contact the office, and make sure that you subscribe to the channel, check out the website, and see if there is anything that you can learn from it. I'm here for you for any questions you may have. Until next time, take care.